I do ostomies this time. I've got my clean gloves on. Remember, anything respiratory is sterile. Anything gastric is clean, okay? So I've got my bin of sterile water, and I need to have some washcloths. You see any over there? Great, thank you. Okay, so now with my clean gloves, I want to have everything ready before I take that off. I want to examine his abdomen. How do we examine the abdomen? We listen first, and we inspect, and then we palpate later so we don't stir things up. All right, so we've got a wafer in a bag, and we've got our measuring device, and we need scissors. I don't know if I have any scissors, so we'll pretend. Okay, so first thing I'm going to do is take the bag off. I'm going to put it in a graduated cylinder and set it aside because we want to measure the contents of the bag. Then we want to go ahead and get a washcloth ready, and we want to clean this area. We do not use soap. We just use water because soap can dry out the ostomy. Now we do have some ostomy soap specifically that you can buy, but it's not the foamy kind that dries out, okay? So, but any other kind of soap we do not use, just water. Okay, so I would clean that out and then put another one, just leave a wet one on top. I think your competency says a 4x4. Do we really need a sterile 4x4 for an ostomy? We just need something clean, you know. If there's dried stool on there, we want to leave that on there because then that'll make it easier for it to come off as well. Okay, while we're doing that, we want to assess the stoma. We're looking for, if it's new, it might be a little bit swollen for a couple of weeks. If it's older, it should be approximately an inch around, and it should be beefy red in color. If it is dark, then we're thinking it might be necrotic and there's not enough blood flow getting through it. If it's sticking out, it's protruding, and so we might want to have them lay down a little bit, see if it'll go back in. Unless it's significantly protruding, then we've got a problem. Okay, we're going to ask them, initially there's probably a little bit of pain with this, but if it's an older ostomy, there's no pain. Okay, so I'm going to get out my measuring guide and I'm going to find one. The ostomy wafer hole needs to be 1/8 of an inch around the mucocutaneous junction. Okay, so this looks like it might be the best one. It might be just need to be a little bit bigger than that. So I'm going to open this wafer pack. I'm going to open this wafer pack. There we go. Okay, no, that's not, there we go. Okay, I'm going to open this wafer pack. There it is. Okay. And then I'm going to take a pen. I'm going to take the hole that I got, and I'm going to take a pen, and I'm going to draw around the hole there. And then I'm going to take a scissors, and I'm going to cut it around the hole. And then once I've done that, I want to take my finger, and I want to make sure that there's no sharp edges along here, okay? Then I would want to measure and make sure that it looks okay with that 1/8 of an inch, okay? Now I'm ready to put this back on, so I want to take a towel and dry everything off. I want to put the stoma, I want to put the waxy portion, it's called duoderm, in my hand so that it can kind of melt a little bit so that when I put it on his skin, we may have a good seal. If he's got redness on the excoriated or on the skin around the mucocutaneous junction, I can take a pea size of stoma paste and put it on the duoderm, not on the sticky part out here because then it won't stick, but this part will still stick. So now I'm going to put this on there, and I'm going to take my fingers and I'm going to wrap around here and make sure that we have a good seal all the way around. And then once that's on, I want to make sure that the bag has a clip. You guys remember how to put the clip on. You're just going to straighten out the plastic. You're going to take the thin part of the clip and wrap it around one time, and then you push it till you hear the click. All right? Now we're going to put the stoma bag on here. I'm not sure these two go together actually. Okay, so they're stuck together, and then now it's ready to go. All right? There shouldn't be any change necessarily because we really didn't do anything. We want to retend to the the bag that we took off and go measure the stool. And then we want to document the color and amount of the stool. Was it the consistency as well, how he tolerated it, what his stoma looked like, what the skin, peristomal skin looked like, what the mucocutaneous junction looked like, and if he was complaining of any pain or anything. We also, at the very beginning, wanted to assess his psychological ability. You know, when this is new, especially when it's new. If it's old, they brought in their supplies, they can take care of it themselves. But when it's new, we've got to see, you know, some people just can't even hardly look at it initially. So we've got to kind of see where they are in the process, because we have to get them to a place where they can take care of the stoma before they go home. And so we have to start that very early. Also, we got to do something about the smell. So we can spray the room, and we can also put some deodorizers in the bag if they would like for us to, okay? If the patient has their own supplies, we can just use those because that's what they're used to. If it's new, we can start with hospital supplies and then tell them where they can get other things, okay? Put the bed back down. Put them in a comfortable position, cover them up. Ask them if there's anything else I can get for them. And then we are complete with this